Again, myself, Dr. Eardow, and Dr. Wynn are the surgeons at the Christian Institute of Advanced Surgery. As such, we are general surgeons dedicated to bariatric surgery primarily. About 80% or more of our practice is bariatric surgery. And to date, we have, well, now it's over 5,000 weight loss surgeries, well over 2,500 gastric bands, and low complication rates with these procedures. We also do general surgery. Some people aren't aware of that. We've had our patients go get hernias done and their appendixes taken out of the surgery because they quote, "Didn't know you did that." But we just wanted to let you know we're available for any procedure that falls into the realm of general surgery as well. And what is morbid obesity? This is when someone has achieved weight 100 pounds over their ideal body weight. So that 5-foot tall female who should weigh about 100 now weighs 200. All right? There's a problem. The body mass index, when you calculate the height to weight ratio, and this takes into account bone structure, is calculated at 40 or higher for those folks. And this is also what's known as clinically severe obesity. And this is relevant because if you take a look at the medical complications that occur as a result of being overweight, the curve begins to take off exponentially. All right? And that's why we treat this.
So what causes someone to be at least 100 pounds overweight? There's a lot of things. There's the genes that we inherit from our family. There's eating habits. You know, if you look at all the other countries in the world, we have the most plentiful food, and we have it relatively cheap. And the bad food is a lot cheaper than the healthy food. If you want to go to McDonald's and get a salad, you're paying about $5. If you go to get a cheeseburger, you're paying $1. You could order off the dollar menu $5 worth of things, and that probably tastes a lot yummier than that $5 salad, but you'll also consume about 10 times as many calories as that salad. We also lack exercise. How many people in this room walked here from home? Excellent. How many people rode their bike from home? How many people drove around the parking lot to find the closest space to the door? I do that. I do that all the time. So, you know, we have to think about it. We are eating more, we're expending less energy, and that's putting weight on. Actually, there's a correlation with increase of weight in the United States since the remote control was actually invented. Because if you think about it, we don't even have to move once we get home. We have our clicker, and all we got to do is click it. We don't even have to get up to change the TV channel anymore. And we also have to look at our environment. It's really hard, unless you live within the near vicinity, to ride your bike here from home. Other countries have it set up where you can actually just take a public bicycle and ride it to a certain spot and leave it there, and then when you come out, you can take another bicycle and ride it somewhere else. They're encouraging you to be healthy, to exercise in every single daily activity that you do. We don't have that set up here.
The weight loss surgery options, again, in our practice are the gastric bypass, the band, and the sleeve gastrectomy. This is how they work. First, we have a gastric bypass operation. In the past, these were done with a very large open incision. 20% of those patients got wound infections and hernias later on, but we're now able to do them with laparoscopy. The largest incision is about 12 millimeters, as wide as my thumb maybe. The smallest incisions are 5 millimeters. And what we do is we portion off the stomach with a stapling device and make this area about the size of half a tennis ball. At that point, we can take the small intestine and bring that up to the small pouch and downstream reconnect, creating a Y known as the Roux-en-Y gastric bypass. And what does it do? It bypasses the stomach exactly like its name. So the food you take in, depicted in blue here, comes down to a pouch, and you feel full very quickly. You cannot eat large portions. Secondly, digestion will occur downstream as the bile and pancreatic enzymes join up with the food in the bypass portion of the intestine. Pictorially, this is what we've done. All right? We've taken your stomach, which can hold about 1.5 liters, maybe 2 liters if you push it. Think of a 2-liter bottle of soda. right here. Little inside calories, all right? That 2-liter bottle of soda is now cut down to half a tennis ball. Okay? At this point, the restriction of the gastric bypass causes decreased caloric intake. So essentially a diet, right? Decreased caloric intake, not eating as much. However, the second part of the operation is the malabsorption. And what happens here is the nutrition that you do take in, calories are not absorbed as they go downstream until they join up with the digestive enzymes and bile at this point. And that segment is usually somewhere between 3.5 to 5 feet long. So there's a significant portion of absorption that's bypassed. The other operation we do, or one of the others, is a gastric band operation. This is also done laparoscopically. This can be done as a same-day or outpatient procedure for the right patient. It's also done in the hospital as well. And what we do here is, this port is 15 millimeters wide. So that's maybe 2 thumbs wide. And that allows for us to uncoil the band, slide it down inside the abdomen, and no cutting of the intestine or stomach is done here. It wraps around the stomach just like a necktie wraps around your neck. Okay? There is a catheter attached to it, which then is brought out. We bring it out through this incision, not a new one. So you get one less incision. But we attach a port at this point, and that port is buried under the skin. It does not hang outside like a pocket watch or mounted to the skin like a cyborg. I get asked that question at every meeting. I'll just take it off the table now. Okay? But what happens then is the food that you eat comes down, goes into the little pouch above the band, and you feel full very quickly. There's a governor around your stomach at this point, and you can't hit the buffet 3 or 4 times in a row. It just is a waste of time. That food then goes through your stomach just like it normally does, and it's all absorbed appropriately. And as indicated here, with some weight loss will come the need to tighten up the band or adjust it. All right? If I lost 30 pounds, I would have to have my collars all adjusted a little bit, right? So what we do is we access the port in the office just with a little numbing medication and inject saline solution in a sterile fashion into the port. It then goes up to the balloon, which inflates. All right? A glorified water balloon wrapped around the stomach. I didn't invent it. Whoever did, doing very well. But at that point, the food then comes down again, and the passage through is slow, and the feeling of fullness is there. Is there a downside here? Well, yeah, there is actually. Again, the less risk, the less upfront investment, the potential for less return on that investment. The band we talked about has a little less weight loss, a little slower weight loss than the gastric bypass. The band will also not pay attention to the foods you do eat, if you so choose to eat bad food. Candy corn, milkshake, soft calorie-laden foods, ice cream, brownie, cookies, that sort of stuff. By the time those foods get from the mouth down to the esophagus to here, they're essentially syrup, and they're going to go right through that band. And it's not going to be able to control it, no matter how tight I make it. If I make it tight enough to inhibit the flow of syrup, your saliva is not going to go through. You're not going to be able to drink. The point is, you need to know who you are up here before we operate here. If you're a sweets eater, if you're addicted to McDonald's sweet tea, we have to fix that before we do any operation. Okay? But certainly, a band is not going to be the best choice for you. This is a gastric sleeve operation. And how do we do that? Again, it's a laparoscopic operation, utilizing essentially the same array of ports that we do for gastric bypass. We do what's called a gastric sleeve. You can see your anatomy is laid out here. Esophagus leads to stomach. And if you remember, the size of the stomach is about 1.5 liters. On Thanksgiving, we can push it to 2 liters, right? And what happens is, basically, you can store too much food. More food than we need now as humans to get by. So what we can do is take the stomach and trim along here, making a very narrow sleeve of stomach. And then this portion, it's called a gastrectomy. Ectomy means remove. Remove, that's the portion of stomach. Right? That seems pretty severe too, right? But what does this do? This creates significant restriction of how much we can eat, just like a band. All right? And we take away this portion of the stomach called the cardiac portion of the stomach, which secretes a hunger hormone called ghrelin. Think growling. My stomach's growling. Okay. And by reducing the quantity of ghrelin circulating in the body, we don't get that terrible, oh my God, I need to go get some food sensation that grips us maybe at 10 p.m. and we have to run downstairs and raid our kids' Halloween candy. Okay? So it works not by malabsorption, but more so by restriction. And there is some biochemical effect in the body, meaning the hormone levels in your system have been altered. So, pure restriction is a gastric band. Restriction and malabsorption is a gastric bypass. And somewhere in the middle is the gastric sleeve. We call that the happy medium between the two. Again, the weight loss with the gastric sleeve hovers somewhere around 65% in a year, with prolonged weight loss in the 60 to 65% range.
Let's talk a little bit about potential complications. If we look at gastric bypass, probably the potentially serious complications would be leaks and blood clots. Now, leaks would be situation that can arise if the connections that we make here, or the cutting of the stomach, the healing doesn't happen properly and substances start escaping to the rest of the abdominal cavity, and that can create a very serious infection. That would be a serious complication. The good news is that it is very rare nowadays in very strong programs like ours. In fact, the last time we saw a leak from a gastric bypass was over 6 years ago. But even if it happens, we know how to take care of it, and obviously we feel that it's very important to concentrate on prevention, so much so that at the time of the surgery we will perform different tests to make sure that those wounds are very well sealed. We put a very strong blue dye, for instance, down the food pipe into the little stomach across that little connection, and we do this forcefully to see even if there is a small dot of blue dye, and we will accept only 0 dots of blue dye as the outcome. And then on top of that, we do also an air test at the same time during surgery by actually pumping air down the food pipe and putting the whole connection underwater to see if there are any bubbles, just like you test a tire, essentially. And how many bubbles we will accept? 0 bubbles again. So we really concentrate on prevention, and we have been very successful with that. Blood clots can happen with any surgeries. As it happens when a person is overweight, does have an increased risk of blood clots with surgery. So our patients obviously are at a higher risk, and again here we concentrate on prevention. We will put people on blood thinning medications right before surgery, and then after surgery some people will actually go home on blood thinning medications. We will put special boots around the legs to improve circulation and minimize blood clots, and we will get the person to walk early after surgery. As early as a few hours after surgery, people will be required to walk in the holes of the floors as a way to minimize the risk of blood clots, and we have been very, very successful in doing that as well. So 2 of the potentially life-threatening conditions very well controlled in our practice, making this a very safe program from that point of view. There are other complications that may be more common than the last 2, but they are much less severe in their impact. Something like ulcers, I did mention earlier on. Ulcers can happen at the connection of the stomach and the intestine, and that is much more likely to happen if the person is a smoker. So we say absolutely no smoking after weight loss surgery. In fact, one of the requirements we have is that smoking should cease well before surgery for all the procedures that we offer. As I said, medications like aspirin, non-steroidal anti-inflammatory drugs also can make that possibility. Well, hernias can happen, nausea and vomiting. Something called dumping can happen with gastric bypass, and that is a set of symptoms including being sick, having pain, or diarrhea, or even passing out when the person who had gastric bypass eats a refined sugar, like a dessert. So candies, cakes, ice creams can do it. So people who had gastric bypass don't have much of a chance to eat those things, because if they do, they get the dumping syndrome. And for some people, that's really a welcome situations, because they will not be tempted if they have a sweet tooth. For others, it may be a reason not to look at gastric bypass, but clearly dumping syndrome is an issue that is going to be there. Hair loss and lack of vitamins can happen, especially in the first 6 months. So, as I said before, the issue of malabsorption is much more common with gastric bypass, and we insist that people take multivitamins as well as additional vitamins like B12 after the surgery. If you look at complications of the gastric band, probably the more common complications would be slippage and pouch dilation. Slippage is a situation whereby the band can slide up or down of the stomach, or the stomach itself can insinuate itself from this level to this level, bringing a much bigger stomach right here. And that is a situation that sometimes is treated without surgery, sometimes it may require surgery. It is much more likely to happen if the band is too tight. Again, another reason to avoid the band being too tight. Erosion can happen, but it is very rare. It's a situation whereby the band actually penetrates the stomach wall, and that would require removal of the band if it does happen. Pouch dilation is a situation whereby the upper portion of the stomach actually stretches, and that can happen with recurrent overeating or drinking carbonated liquids, which is another thing that we will not be recommending after surgery. And that often is resolved by releasing fluid from the band and resting the stomach on a liquid diet. Poor weight loss is seen more commonly with the band than with other procedures for a number of reasons. Some patients just don't seem to do well with the band, others struggle to be compliant with the requirements. In other words, you may have restriction and good control of hunger, but if you go on eating mushy foods continuously, the weight will go up, or if there is no good follow-up with the office to adjust the band regularly, or if there is no commitment really to the changes that we talked about, then people may struggle. Another reason might be the fact that weight loss occurs much more slowly over time with the band as opposed to the other procedures, and some people may be discouraged by the fact that the weight loss is too slow. With the sleeve, the complications are in a way similar to gastric bypass, at least as far as the serious complications are concerned, leaks and blood clots. And with the sleeve, again, prevention is where we concentrate on. We actually insert a telescope inside the sleeve, and we look at this connection with the telescope at the time of the surgery, and insufflate this and put it underwater to make sure that this connection is well sealed at the time of surgery. Blood clots, the same prevention we talked about earlier on. Ulcers are much less common. Bleeding may be a little bit more common with the sleeve, just because the stomach is very well vascularized and there is a long wound on the stomach, but again, it has not been a major problem for us. That stomach can dilate over time. It can get stretched if the person overeats, and that can lead to weight regain even with the sleeve. Reflux is something that can occur or become worse after this procedure. So people who have very severe reflux may not be the best candidates for the sleeve. Gastric bypass, on the other hand, is great treatment by itself for the reflux, because we are removing the acid-producing stomach away from the food pipe with the gastric bypass. So we talked about the complications. In terms of the results, they are really fantastic, with over 50% excess weight loss across the board, improvement in illness, quality of life, and improvement in self-esteem. This is a diagram we use. It's from the Cleveland Clinic, and it shows us really the number of illnesses that can be improved or completely eliminated with weight loss surgery. And it's really staggering that one procedure, one surgical treatment can tackle so many illnesses that traditionally have required. Lifestyle changes that are necessary. Quitting smoking is very important. Postponing pregnancy is important because sustaining a pregnancy in the time of rapid weight loss, in the first year, year and a half, is not recommended. So for women of childbearing age, we actually recommend that plans for postponing for pregnancy should be postponed until after that weight loss is substantially completed. And but after that, they will actually be much healthier to carry a pregnancy than before the weight loss surgery. The non-steroidal anti-inflammatory medications we talked about, but that would apply mainly for the gastric bypass and the gastric band. Stopping alcohol, I wouldn't say completely, because alcohol in moderation, especially some types of alcohol like red wine, may actually be even beneficial. But it's important to understand that moderation is key here, because especially in situations like the gastric bypass, it could be dangerous because absorption into the liver is so quick now. And not only the person tends to feel the effect of the alcohol much more quickly, but the liver can be damaged with too much alcohol intake. Commitment to exercise and different foods, again, is the commitment I introduced at the beginning. Again, to reiterate the fact that the attention to healthy eating and regular physical activity are still the foundations of healthy weight loss, and that we are providing tools to help in those foundations. We're not really taking away those fundamentals and just substituting them with the surgery. The surgery has to be on top of those important fundamentals. The reason to be successful really is not only by coming to an experienced program like we have here at Christiana, but really because you're going to be committed. So commitment is extremely important, and that is a big part of the preparation process to make you understand really a lot of this success will hinge on how committed that person will be. So that's number one, and that's number two, and that's number three.
So some common questions that we get, well, what's the hospital stay for a bypass and sleeve? It's about 2 nights in the hospital. For a band, you could go to a surgery center, be discharged the same day, or have an overnight stay in the hospital. And time off work with a bypass and sleeve is 2 to 4 weeks. Band, 7 to 10 days. The earliest I've seen someone go back to surgery after a band is about 4 days after surgery. I don't want you to be scared of weight loss surgery also, because it does give you fantastic results. Over 50% excess weight loss, improvement in your medical problems, improvement in your quality of life, improvement in your self-esteem.
Journal after journal after journal in the medical literature points out that bariatric surgery is the most effective and longest lasting treatment for severe obesity that we have. It sends diabetes into remission. It improves high blood pressure. It can eradicate sleep apnea. It can reduce the incidence of depression. It can enhance fertility for those seeking to become pregnant. This is all about weight